Hello, I'm here to talk about regenerative procedures. Regenerative medicine is a field where we're able to use platelets and stem cells. These are all derived from your own body. And what we're able to do is help regenerate some of the tissues in your major joints and in your spine. And by doing this, we can take away a lot of your pain and discomfort, inflammation that you have from common pain conditions. The reason why these things work is you look at it from the beginning of time. Your blood platelets have a lot of growth factors. Every time you get cut, if I cut myself over here, a scab forms. That scab is all platelets. So those platelets have a lot of growth factors. When that scab falls off, there's skin that is formed just kind of like brand new. And that's because the scab's growth factors promote growth of skin. So the way platelets work and the way stem cells work is if you place them in an area where you have damage, then they will regenerate that tissue. Common fallacies or common things that people say that can happen but don't happen, for example, cartilage growth. No one can make knee cartilage or shoulder cartilage. No one can do that. No one can make meniscal tissue. But we are able to make tendons, ligaments, muscles, so we can regrow that tissue, restabilize a joint, restabilize the spine, and by doing that, we can take away a lot of the instability, and that instability leads to more arthritis, so we can slow the progression of arthritis and take away inflammation. So just to give you an idea, normally what you would do is when you go to a doctor's office and you say, I have knee pain, they may get an x-ray, they say that you have some arthritis, mild, moderate, severe arthritis, and they'll say, hey, look, a lot of your pain is from the inflammation within your joint. So what they'll do is do a steroid injection. Steroid injection will go right into your joint. They may use image guidance, they may do a blind approach, but they'll basically place a needle right here. This is your meniscus, but they'll place a needle right here. They may inject some dye, or they may use ultrasound guidance and confirm placement, put some steroid there. You're gonna feel fantastic for a few weeks, months, sometimes up to a year. And the reason you feel well is because they took away a lot of the inflammation. We kind of want to go a step further and say, hey, why did that inflammation happen in the first place? Oftentimes you can have a meniscal tear. So this little blue thing right here is the meniscus. If that meniscus gets torn, you now have your knee buckling this way. Or if this side is torn, maybe your knee is buckling this way. But essentially what's happening is there's this imbalance, kind of like a tire that's out of alignment. There's an imbalance. And anytime you have an imbalance, you think about kind of your own normal actions on a daily basis. You take 1,000 steps a day, 5,000 steps a day, 10,000 steps a day. And if you, every time you step, have an imbalance, you're gonna have abnormal wearing of a joint, whether it's this end, whether it's this end. Your muscles, if they're not strong enough, they may shift this whole apparatus forward or backwards. So by just doing a steroid injection, you're really not going after the cause. What you're doing is just saying, hey, you have symptoms of having inflammation, let me just take care of the inflammation. With a regenerative approach, what we do is the following. We first obviously take a good history and physical examination, and we look at your clinical symptoms. Where are you having pain? Is it here? Is it here? We see where your pain is, and during the evaluation, we'll check these ligaments. If there's a lot of stretch right here, this is the medial collateral ligament, or if there's a lot of stretch right here in the lateral collateral ligament, or if I can shift forward and backwards, then I know there's an underlying ligament issue. And what I want to do is maybe get some further imaging and decide exactly where most of the damage is. So if I find that there is a ligament issue, instead of having this ligament be so lax that your knee is always going this way or this way, and the reason that happens is over time, because your meniscus becomes very thin, you see a lot of buckling. So what we do is we say, hey, let's take an ultrasound machine so I can precisely inject into this ligament, into this ligament, into this tendon, I can inject I can inject into the ACL. We can inject into any location by putting platelets for mild or moderate arthritis, or using stem cells for moderate to severe arthritis. We can rebuild these ligaments. And so now that whole knee apparatus is very stable. And by achieving that type of stability, everything functions well. This platelets or stem cells will also take away a lot of the inflammation within the joint. So you're taking away the inflammation, you're making the joint more stable. So now every time you take a step, every time you run, every time you do any type of activity, there's a lot more stability, you decrease the progression of arthritis. This is the whole goal of regenerative medicine, and really why we do this and why we're achieving a lot of success, and why this is kind of driving medicine forward in a more natural way, instead of using a lot of steroids and chemicals which can have other side effects for your